welcome Ruth from the NHS Herefordshire and Worcestershire CCG, who's the Director of Strategy and Transformation, and she's coming to talk about the STP response to our Covid-19 reports. Thank you very much for joining us, Ruth.
Pleasure, thank you. So shall I just kick off then? I haven't prepared any slides, but I know there was quite an extensive set of paperwork shared. So just by way of background then, obviously there's the very comprehensive reports that Healthwatch Worcestershire developed, and alongside that some reports from Healthwatch Herefordshire, and the region also did a response to COVID. And as an ICS, as a system across Herefordshire and Worcestershire, we also engaged with our staff and a few patients to get their feedback, and all of those were really reviewing what we now refer to as wave 1 of COVID, and what learning we can glean from that experience. So because we wanted to take all of that learning in the round, we pulled together a group with representatives from a range of different organisations in our health and care system, and we did quite a forensic job of going through the learning and the feedback and what was captured, and then put this report together that we then shared with the STP Partnership Board. So if I focus initially perhaps on the Healthwatch feedback and our responses to that, and then we can potentially broaden it out if colleagues are interested. So clearly the Healthwatch Worcestershire report had an incredible 2,500 respondents. So it was, from our perspective as a CCG, it's just incredibly useful to get that scale of feedback. It was an impressive suite of reports, and of course there were some special elements dealing with LD and autism, and a particular focus on GP practices as well. So all of that learning was really valuable, and I think I can say that we fully accept the recommendations in the report. I mean, things like promoting local information sources, ensuring that it's accessible and that it's tailored to the needs of different groups, including those with caring responsibilities or disabilities, and then also the service Here to Help, which hopefully you'll be familiar with, was widely used and relatively well known about across the county, but there were some areas that perhaps weren't using Here to Help as much as they could have done, or actually weren't even aware of it. So all of that feedback for ourselves and our partners has been incredibly useful. And there was also quite a lot of feedback about access to services. I think there was a particular issue around dentistry and pharmacy, which really landed and resonated with us. And not asking for the survey to be redone, but I do hope that some of the experiences in this and hopefully not subsequent waves will demonstrate that we have improved our responsiveness in some of that area. In some of those areas. And of course that the ongoing communications with the public is just so important, and I think that shone out of the Healthwatch report. And then another particular stream for us in here was the mental health and emotional well-being, both of children and adults, and I think that that's probably even more pronounced this time than perhaps the experience of the first wave. So communicating how people can access mental health support is going to be incredibly important, and that's something we're emphasising. Actually, I'm involved with a call with one of our local MPs tomorrow who's picking up on particularly that point. So that was a kind of summary of what the Healthwatch report found. So what we then did was just review our STP work streams across Herefordshire and Worcestershire, because there was some similar findings from a Herefordshire Healthwatch survey, although it didn't manage to reach the number of people that colleagues in Worcestershire did, and really consolidate that to say, well, what does that mean for us? And I think from the Healthwatch report, it was a particularly strong emphasis for our communications and engagement work stream, and how we can really strengthen that going forward. And you may be aware that we're revising that strategy at the moment, and I'm sure Sue Harris will be involving you in that as we go along. So really giving us an emphasis and some direction as to how as to how we do that. One of the other things, and this was actually germane to all of the reports, not just the Healthwatch ones, we were really concerned, those of us who were doing that review of all of the reports, about people who might not have been able to give their feedback, because we were in the main accessing people digitally, electronically, and therefore we weren't able to hear from people who weren't able to access services in that way. And that's been a concern to us from the very beginning. And we do now have a digital inclusion group that is specifically focusing on ensuring that we engage with, get feedback from, and enable service access for those groups. So an interesting perspective actually from our COVID vaccination campaign, in ensuring that there are other ways to book into your COVID vaccination other than follow this link to X. But I know there's going to be some concerted effort through that digital inclusion work to make sure that we are picking up on those areas. The restriction on face-to-face access has come across in a lot of the reports, and when we've taken this to frontline services, they have all said that they are committed to keeping face-to-face access where it's necessary. So I think that's, again, another one for us to keep a close eye on. And alternatives to access, such as telephone and video, making sure that that is genuinely a viable option. And that's not just about ensuring that people have got the devices that do that, but they've got the bandwidth, literally physical bandwidth, to be able to optimally access those appointments, and then have got the data, etc., to be allowances to be able to access. So all of those things are being picked up through the digital inclusion work stream. And then, as I said, I think the main bulk really fits in with the work of our comms and engagement work stream, making sure that we've got all of the information that we need out there in multiple formats. Particular emphasis, I think, also on self-help, to make sure that people are able to access that readily. So we're ensuring that all of this information is captured, and we are, through our partnership board, which I know Healthwatch colleagues sit on, making sure that we're following up on these actions. So it's not just a bit of paper that says, oh yes, we've listened, but actually we're reporting back to our partnership board to say, and this is what we've done, and this is what we're learning. And so we've got that virtual feedback loop to help us. So I wasn't going to say anymore unless there was anything specific you wanted me to pick up on, but more than happy to answer questions.
Thank you very much, Ruth, for that update. Does anybody have any questions from the board? Can't see any hands up. Simon, did you have something that you wanted to ask?
I think I saw Peter put his hand up.
Did you put your hand up, Peter? Oh, you're mute.
You're on mute. Peter, on mute.
Is that better now?
Yes, perfect.
Thanks very much for that feedback, Ruth. I wanted to ask a very kind of local personal question regarding my own patient group in and around Droitwich, and obviously on the digital exclusion. What I'm trying to get my mind round is the CCG have a handle on what the gap is? How many more iPads do we have to available? How do we get people who haven't got access to the IT digital stuff to use their surgeries as a way of communicating? Is there any kind of practical plans about that?
Brilliant. Yeah, no, that's a really helpful question. Thanks, Peter. And I can't answer it as fully as I know colleagues would be able to. So I'll give you just the high level, and maybe we can follow up with some more detail. So yes, and I would point you to our digital inclusion group, but do we understand the gap? No. Are we working to understand it? Yes, we are. So that's a work in progress. And then use of hubs and GP practices being a really good example of that, potentially libraries, etc., where people can go who wouldn't have access in the home, but could access appointments, engagement, etc., elsewhere. That is completely on the to-do list for our digital programme, but I don't have chapter and verse on it, Peter, but I can find out for you and feedback, because I do know that those are in development.
Mike Lambden, you've got your hand up. Would you like to ask a question?
Right, thank you. I was just going to comment on what Ruth said about pharmacies. Certainly in the early days, from a patient perspective, I think that was the big issue. There were big queues everywhere. People were struggling, partly brought on in discussion with the GPs by people mass ordering prescriptions, which sort of double whammy. In answer to what, just following on what Peter said as well about access to digital, one thing to remember is that as older people get older, some of them start losing their faculties and can no longer use IT, even though they might have been very good at it before. Before they even have dementia, they perhaps get a bit flummoxed by things and no longer can sort of use what they used in the past. So I think even providing stuff isn't going to help that.
Yes, and thank you, Mike. That's really the work that our digital inclusion group is alert to. That there are some people for whom we're just not going to resolve it through digital means, and there needs to be alternatives for all types of care.
Okay, I think Lee wanted to ask a question.
It was just to say that there's certain hubs and centres like Sandycroft in Rachel that does have an IT suite. And, you know, I can relay back now that it's not utilised adequately. There's more capacity there. So some of that digital inclusion could be something about making more people aware that there are organisations where people can go within the voluntary sector, not just libraries. We've got a whole IT suite, and it's hardly been used at all in this COVID. Even though we're open, they could have come in. So there is a resource out there that's not being tapped into or utilised. And again, like you say, with older people or people with mental health being in the voluntary sector, we were able to give them that bit more sort of support through that process. So I definitely do think that it's an area to be worked on. But obviously, as the voluntary sector isn't necessarily funded well or has great IT marketing budgets, etc., you know, maybe it's how we look at that to make sure that gets out to people to use more effectively.
I'll feed that back. That's a fantastic suggestion. Sort of making sure we've got a really comprehensive map of all of our community assets, including digital access. Thank you.
Yeah.
Simon, I think you're the next hand up.
Okay, thank you. I was going to raise the issue about the digital inclusion, but I think you've covered that off, Ruth, because digital inclusion, that term sort of implies we're actually trying to make everybody digitally included rather than accepting that there are some people, and you've said there are some people for whom that just isn't going to work. So you've dealt with that one. The other one a couple of other issues I wanted to raise with you while you're here is first of all around long COVID.
Yeah.
Arrangements, and you may not be able to answer this question now, I accept that, but arrangements that are being made in the county to support people who may have long COVID.
Yeah, so again, it's one that I can give you a summary bit of feedback on, Simon, but I can point you to other people who've got the detail.
Okay.
So we are setting up long COVID clinics at the moment, focused in Worcestershire acute. So Mike Hallisey's leading on that. But we're looking to have it more as a community service. And it's Hazel Braun, my colleague. So I'll ask her to drop you a line, Simon, with a bit more information about how that's evolving at the moment. But she is working on it. We do have regular updates. So thank you.
Okay, and my last point, which is really not to do with COVID, is around Diabetes Network. And maybe this is something you could take back. For a long time now, prompted by patients, we've been asking what's happening to the Diabetes Network in Worcestershire. I think usually we get back a response, well, COVID-19 vaccination program, etc., is getting in the way of what we're doing. But we're really interested to know when we're going to get to a point where we've got a network that's going to engage with patients.
Yeah, thank you, Simon. My diabetes lead is actually one of the few people who hasn't been redeployed with COVID vaccination. Unfortunately, she has herself been off sick for a few months, which is why we haven't progressed it. But I'm hoping that she is going to be back by the beginning of next month, and I'm totally aware of this issue. I can speak to it. We're on it, and in fact we're looking at really emphasising the support we're giving to diabetics as we're going forward, because we know they're amongst many other groups, they have been disproportionately impacted through this work. So a tick on that one, but maybe not just yet, Simon.
Okay, thank you very much. But if you just keep your eye on that, because we'll bring it back at our next meeting as well.
Yeah, do. Okay.
Because it's been rolling for a long time now.
I know it has.
Yeah. Thanks, Joe.
Yeah. Are there any other questions that anybody has for Ruth? Okay. Thank you very much for joining us, Ruth. That's been really interesting.
Thanks. And thank you for all the work that you did. That's been really, really helpful. Thanks.
Thank
Bye.
you. Bye.
Bye-bye.